What are the symptoms of pelvic nerve irritation in men? In this video, I'm going to not only give you the symptoms, but also give you the path, the first step towards fixing the issue. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I hope you have subscribed to my channel, and if not, I hope you do by the end of this video. I strongly encourage you to make sure you put a comment at the end of this video or any questions you may have. So let's start talking about pelvic nerve irritation. There are nerves that exit the back portion of your spine and your sacrum that go into your pelvis. There are nerves that influence these things, and not as much, but there are nerves like sciatic nerve that actually, believe it or not, impact the health of your pelvis. In men, symptoms are not always about urinary issues. Usually it's basically dripping quite a bit or a little bit. It's not about sexual dysfunction, though it could be sensitivity of their penis, or either hypersensitivity or hyposensitivity. This could be before the arousal or after arousal or during the arousal. It could have to do with pelvic instability and associated issues there. It could be essentially sexual dysfunction that they may have. It may be a bladder, or not a bladder, I already mentioned that, but constipation issues or bowel movement issues, and things that basically causing pain in the groin. It could cause an increased tension in the muscles of the floor, in the perineum. It could be tension at the base of the penis or too much tightness around the anus. A lot of times there is like a golf ball feeling that exists in the perineal area, and a lot more. These are some of the symptoms that are presented, and they all, depending on what's going on, they all, at least in my practice, when I start asking patients to tell me more about their history, I can very quickly see the extent of dysfunction that exists. You see, the muscles inside of your pelvis work with the outside to stabilize the pelvis. And pelvic stability is so important because without a strong foundation, the structures above are compromised. You are the structures above, because without your upper and lower extremities, you're simply disabled. Without your trunk, you don't exist. So we can have issues on the outside that the muscles on the inside react to. And that reaction to the environment outside can actually impact the nerves that go around it or inside of this pelvis. If that nerve, let's say pudendal nerve, is going through, and it's going through a path of small places, small crevices, tight areas, then that muscle can very much be irritated, not muscle, the nerve, very much be irritated, being compressed, being stretched. There are so many different scenarios that can exist. So for us to block the nerve, using nerve block as an example, how is that going to take away the tension? How is that going to take away the compression? It's not. So when we look at the why behind the reasons, we very quickly see that it's the dysfunctional patterns of movement that have taken away the stability of this individual. And this lack of stability in the pelvis and the connections to the pelvis are the reasons why there are these symptoms and these presentations. How do we go about fixing it? I am a firm believer that your body parts are here to serve you. They are here to serve you, doing the job that is their main job. When we take away the opportunity for them to perform their main job, of course, things become dysfunctional. So the first step in the right direction is always biological breathing. That's the kind of breathing we have learned by studying human babies. If you have not subscribed to my channel, you have no idea what that looks like. I'll make sure we put it at the end of this video. But this is your great opportunity to make sure you subscribe to the channel using one of the methods of contact. In the description box, you can contact me, but to subscribe, all you have to do is click subscribe and turn on that notification bell. So now, when you start with biological breathing, you provide the opportunity for these muscles to behave closer to what they're designed to do. When your pelvis is stable and you're breathing biologically, the inner abdominal pressure will go straight across this area and impact all of these muscles equally. The process of breathing out requires the same muscles together to come and basically work together, contract, and reverse the process. Therefore, we breathe out. The next step we want to do is to stabilize the pelvis by removing dysfunctional patterns of movement. You have no idea what that even looks like. The reality is you have moved away from the primary way, the main way our body was designed to move. We know what that main way is because every human being starts as a helpless infant and somehow become running toddlers. No bands, no weights, no guidance, and it doesn't matter what part of the world you're from or what kind of a family you're born in, we all move the same way. It's so precise that we can compare a child's development to this chart of movement. So that to me looks like what? Manual of movement. So that is how we detect where the dysfunction is and how to stabilize the dysfunction or remove the dysfunction and replace it with functionality. So it doesn't matter what symptoms you have. We start with biological breathing. We start by, at least this is what I do, I start by basically taken on patients as mentors because now we need to look at the project together because at the end of the day you need to be understanding and having and holding that knowledge going forward. You need to recognize what right looks like, to recognize what your tendencies are, what are some of the activities that negative that you've done without even realizing, like how you work out, great example, or lifestyle choices that you've made that have negatively contributed to this. So you need to understand what functional looks like, what right looks like, what your version looks like, so you stop yourself from committing the crime. Is that for now because you've got nerve irritation leading to pelvic floor dysfunction? No, it is forever. Once you know what right is, it's not temporary and for now. This is kind of like driving your car. When you're driving your car, at what point is it okay? After how many years of driving is it okay for you to pass a red light? Never. So it's all about educating yourself, understanding the practicality of this knowledge to your real life that will allow you to solve the problem and minimize the chances. I hope this made sense. Please use this opportunity to comment because I really enjoy getting comments and replying to your comments there. If you have any suggestions for any videos, please do so. I do check these things myself and I will definitely respond to them. Until next time, take care.